Ms. Alisa Prazel,
What's going on there?
She's online.
Katie McClendon, Mary Jackson, Doreen Soiber. There's something. Doreen?
Can you hear us?
Yeah, I don't think they can hear us.
I can hear you.
Oh, okay.
Lisa Castillo,
Here, good evening, thank you.
Marjorie McPike, Laura O.T. Gonzalez,
Here, good evening.
Ariel Tola Bishop Williams, Eric Anthony Davison,
Right here. Good afternoon, everyone.
Colleen Wallace,
Here.
Melinda Opperman,
Present.
Ariana Rodriguez.
Yep.
Yakuba Brown,
Yes.
Jamie Apatia Zap,
Here.
Bridget Moore,
Here.
thank you. Greg Rodriguez,
I'm here.
Edgar Garcia,
Yeah.
yes, no problem.
Okay, very good. We have a quorum. So moving on to item 1.2 is the CAC vacancies. Emma?
Yes, we have a District 3 private sector vacancy. So we will be meeting with the District 3 to identify a potential candidate. And we will make sure that we provide an update to the commission at the next meeting. Once we've been able to identify that individual, we are going to, it's not included here, but we are going to the board on April 28th for our District 2 vacancies, as well as our District 5 low income representative. And we will have a little bit of a presentation just down the agenda, and we'll introduce those individuals to you.
Any questions at all? All right, moving on to item number 2 is public comment. So there was a public comment submitted that was received and recorded for January 15th. Is there any current public comments? Right, not seeing any. We'll move to item number 3, which is the partner spotlight. It's the Housing Workforce Solutions Office of Homeless Service Division, and I believe Joshana is going to present.
Yes, thank you. I don't know if I to say good afternoon or good evening. I think my name is Roshana Walker. I am a principal development specialist here with our Office of Homeless Services, one of our sister divisions of CAP. And we thought it was a good idea to come and explain what our office do and what we're responsible for here with in Riverside County for our through our continuum of care throughout our county. So if you can just advance to the next slide. Would you rather me go up there, or I can stay here? I can stay here. Okay, good. So what the continuum of care is, it was designed by the Department of Housing and Urban Development, which is HUD, as everybody here referred to as, and it was to promote a countywide commitment to the goal of ending homelessness. So our continuum of care is a regional body that is made up of, and we're responsible for coordinating and funding the delivery of housing services for people experiencing homelessness within our geographical area. And this continuum of care brings together a number of organizations from community-based partners, faith-based organizations, other government entities, cities, et cetera. So we come together for coordinating our efforts to end in the goal of homeless services. And if you can advance to the next slide. And the next slide talks about our structure. And the way our structure is made up is we have our Board of Governance, which is the Continuum of Care's governing body. And those members are elected to a seat by the Continuum of Care membership. So our Continuum of Care is governed by our Board of Governance. And then we have our Continuum of Care membership body, which is made up of Riverside County service providers and stakeholders with the interest of solving homelessness within our county. And I failed to mention a lot of our continuum of care, we have some homeless services advocates. So not necessarily just agencies, but we also have advocates that are on our that are in our continuum of care as well.
And actual homeless individuals that, yeah.
Thank you.
Persons that are experiencing.
Yes,
homelessness as well.
those with lived experience as well. Thank you, Emma, for adding that. And then what we do at our office, we are the lead agency for that is responsible for bringing homeless funding into our community and coordinating that service delivery. So that's what we do here at our office. We're responsible. We always look for grant opportunities, bringing more resources into Riverside County. And if you advance to the next slide, it's the other way. This is just an illustration of how our system works. It's by no means is it perfect, but we are always striving to improving our system. And I believe we've done a great job with the system that we have now. So how it works is we've invested in street outreach teams that go out and meet the individuals who are living on our streets where they are. That can be in riverbeds, that can be in parks, that can be in abandoned buildings. These street outreach teams meet them where they are and help them navigate through our homeless system. And then moving on to emergency shelters. So when they meet them, they first build a relationship, rapport, get them to trust, and then offer some resources to include some temporary shelter for that individual. You have a question?
With your street outreach, case management, are they people that work for the county or they're outside?
So we have both. We partner with community-based organizations as well as other county departments such as behavioral health. So we have both with nonprofits or community-based organizations as well as other county departments that provide the resource, the street outreach. And then moving on from emergency shelter, we try to, because that's a temporary parking space, right? So we try to, through case management, move them on to getting them to some type of permanent housing option, whether that's reunification with their parents or adult children, but some kind of diversionary services. We or rental assistance, other rental assistance programs, or even permanent supportive housing, which is the next that you see on our little street there. But all of our permanent housing programs, they come with case management services. So I was explaining to someone earlier today, the real work begins when they get housed, because without that strong case management, once they're housed, we may see them back on our street. So we promote that strong, intensive case management once they are in permanent housing. So again, I tell everybody, once they get into permanent housing, that's when the real work, that's the hard work. Because our goal is so that this help assist that household reach self-sufficiency. So that's why we have a heavy emphasis on case management once they're or in housing. Now, obviously, we do case manage while they're in the streets, but we want for them to reach that self-sufficiency. Our finish line we have up there, which is our continuum of care mission or vision, is where homelessness is rare, brief, and non-reoccurring. So that's our continuum of care. Vision is by 2027, homelessness is rare, brief, and non-reoccurring. And one thing I want to add to our system here, which we've recognized and we're working on improving that, is once they get into housing, I talked about the self-sufficiency piece. We recognize that we were missing the employment piece. So now we are adding that employment piece to our system and our programs. We learned through lessons that we try to have that employment piece in the outreach stage.
Yeah.
And didn't get a lot of reception because individuals are just trying to fight and figure out how they're going to get their next meal.
Mm-hmm.
And we're out here trying to try and push them to get jobs. So what we've learned is once they get into housing, once they get into a stable environment, let's work on getting them that employment piece. And then
So on this slide, once they reach the permanent supportive housing on this roadmap, that's when you guys start working with employment.
employment, yes.
Yeah, okay.
We have a strong partnership with our workforce development department, which is another arm of our housing and workforce solutions department. So yes, we are building that bridging that gap that we recognize that we just needed to move it in our system.
Can I jump in?
Yes.
Yeah, so I just wanted to take a minute to introduce myself. My name is Tanya Torno, and I'm the deputy director that oversees our Office of Homeless Services and the various programs that Roshana talked about. What I really wanted to emphasize is that in addition to local funding that we're very fortunate to receive through a general fund allocation that supports emergency shelters, we've really been able to build out this system of care, leveraging federal and state resources, some of which are allocated to us. But I will say the vast majority that we competitively go out to apply for. And I think that's really, really important because when you just look at the direct allocations we receive, it's probably about $30 million. And while that sounds like a lot of money, when you take into account that rents today, I think the average cost for a 2-bedroom is about $2,500. You know, that money goes very, very fast. But in the spirit, I think that every person in this board shares, we are always looking for opportunities to do more. And so we've been able to leverage additional resources, upwards of 100 million, to build out this entire system. And to that end, as Roshana shared, our role is in making sure that we're funding these various projects. And so we make those resources available through a competitive bid. And the piece that I really want to emphasize, given that there's been a lot of sort of feedback, right, around homeless dollars, that even at the state level or at the federal level, is that we really take to heart the accountability and compliance piece. And so I just want to assure you that part of our role is the compliance project management side. And so we're actually going out on a regular basis to monitor these organizations to make sure that their outcomes are excellent. And in addition to looking at sort of project compliance, project outcomes on a systems-wide level, using a homeless management information system, we're able to capture a full story of how our entire system is doing. So I'm proud to share that we've had great success. Last year, we saw for the first time a 19% reduction in the number of people that are unhoused across our county. And again, we recognize that it's the work of the system, but it's also the work of, right, all work that's done across community-based organizations and our county departments in prevention, and through the workforce component that Roshana talked about. The second piece is, in addition to coordinating programs and making sure we're providing good customer care, another critical role that we carry out is helping those agencies build capacity so they have the tools, and so that their staff are fully equipped to carry out these programs. And by that, we host various trainings. In the last 3 months consecutively, we've held trainings on motivational interviewing, on trauma-informed care, on how to facilitate shared housing opportunities, because a lot of the people that we assist, and particularly when you look at like senior populations, really struggle with loneliness. And so being able to match them up with roommates who can be a part of their support system, and also, right, in the long term, helps them from falling back into housing, which is a common theme we see with our senior population when their rent goes up and they're on a fixed income, is extremely beneficial. So on a monthly basis, we're providing those training opportunities, and we're continuing to scale those up so that our nonprofits at all ranges, large scale and small scale, are equipped and ready to do this work. And then going back to our data outcomes, and that accountability and compliance piece, I wanted to proudly share that we're always looking at our sort of retention rate in housing. And I think every year we house about 6,000 people in housing. Of those people, what we have found is that 82% 3 years later maintain that housing. And that's as a result of the case management services that are coordinated, not just to get them into housing, but as Roshana beautifully emphasized, even after housing. So I think it's really important, given this climate, given all the media attention to homelessness, to share that the resources that are used are a multitude, and that we are being accountable. And I think part of our success in being able to reach the budget that we have now is because we have really strong outcomes. So to that end, we thank you guys for the work that you do across Community Action Partnership. My hope is that we can continue to work together, and so that as we stabilize people in housing and help them connect to workforce, that in turn that allows you to meet people that are coming to you for utility assistance and lessen sort of the burden that we all have to support people across our region. So
Tanya, real quick, you mentioned that you're working with a budget of upwards of 100 million. Is that enough funding? It sounds like a lot of funding, but is that enough funding to serve everyone who needs it?
No. So going back to the data element, when we first started, and again, our budget was about 30 million. We only had enough resources to help about 1 in 10 people that came in through our door. When I say help, that means 1 in 10 people that needed housing assistance got that housing assistance. Today, we're significantly better, where it's 1 in 4 people across the county are able to get in housing. But to Emma's point, like, we're still having to turn people away. So to that end, we're aggressively looking for additional resources, because ultimately, we want to bring people to self-sufficiency, but we can't do that, right? We're not even going to get close to that if we continue to have people dying on our streets. And so that's another metric that we closely monitor. And every year we hold an annual memorial. Thank you. And it's one that Emma puts together. So it's like at the top of her priority list. But I will also share that another great success after 5 years, For the second year in a row, we had a decline of,
The death
This-
rate.
or in the death rate of 30%. So we're seeing progress, like,
Mhm.
we're seeing a lot of
Mhm.
progress. And so again, housing is a place where people can stabilize and begin their journey to being healthier, and more sufficient. But yes, we continue to need additional resources. You had a question?
Yeah, I had a
Yeah.
question. I have a question. Do you see more kids that's getting out of foster care and group homes being homeless than you do the people that's like our age or like, I'm gonna say 40 or 35 and above getting the help? Do you see more of that in homelessness?
So we absolutely see accelerated rates of specifically foster youth who are exiting foster care and entering homelessness. That is a very common barrier. But additionally, I will say that the 19% decline that we saw in homelessness included youth in general. So I think we're headed in the right direction because we've, been able to coordinate partnerships with CAP, with behavioral health, with our children's services division so that we can reach young adults sooner. And so the data is trending in the right direction. The decline is good, but again, like you, I think we're eager to stay in this fight until it's until it isn't an issue at all. But yes, foster youth in general are at higher risk of hitting this crisis.
Eric, did you have a question?
Yes, hi, thank you. And this is a great presentation. I really appreciate this information. I just had a couple of questions regarding, is it the rapid rehousing and the 12 to 24-month roadmap? As far as residents that are like on a non-normative life cycle, is there any flexibility with that? Some of our residents are elderly, LGBTQ youth, things like that. Is there some type of leeway? I know you mentioned caseworkers, but is there a way to buy more time, or extend time? And then my other question is if this, like a lot of social service programs, if you are on one program and you qualify, and then it's based on some type of, I don't know, however they calculate the monies, if you will that penalize you for maybe accepting this? Is this count as income?
So,
Oh,
great questions.
That's a good question.
Yeah, all great questions. The first question, when we do or tailor our case management to each household have an individualized need. So there are some programs that can provide 12 months of assistance. There are some programs that can provide up to 24 months of assistance. And even when those or if those households are not self-sustaining at that point, case management does not stop. We look for other ways to leverage or to help that household get even further in that process of self-sustainability. So we always look for ways. We don't just stop with that assistance for each household. We always look for other ways or other avenues that the household is actually eligible for. And the second question, I was so passionate about the first question. Can you repeat the second question?
Income.
Yes, is it considered
If
income?
they have, if they're on other programs, say,
It would
like
be.
CalFresh, to defend the homeless.
It depends on the actual program. So CalFresh is not included in any income eligibility. Cash aid, it could be
But the rapid rehousing dollars are not.
for rapid rehousing, as long as rapid rehousing, no, there is no income eligibility unless, as long as they're literally homeless.
Yeah, I think the question is in reverse. I think if I'm understanding correctly is, does receiving rental assistance impact someone's CalFresh or CalWorks benefits? And I do not believe so. No.
I know that during the rental assistance program that we dispersed with lecturers, it did not count.
Right.
as-
Mhm.
as earned income.
Great question. Great question. Right.
To that, I know that when you get to the permanent supported portion of your roadmap, do you guys find, the lack of on-house folks being able to provide documentation a barrier to get into housing? I'm curious as to how that works. At state level, I know that there's some, advocacy, being done,
Mhm.
especially relating to the coordinated entry system that already exists. And this is kind of just to tackle that barrier,
Mhm.
specifically, but I'm curious what it looks like in our region.
Yeah, so it is common that you meet individuals who, especially if they're chronically homeless, that they don't have their documents because it's either been stolen, lost, or but that's the role of our housing navigators to help that individual uh, regain those documents. So it's not it's a barrier, but that's what the staff and that's what our agency, that's what our commitment is helping that individual get the needed documents.
And I'll say, I think part of having experience doing this work, that I think there's creativity,
Mhm.
and I think that case managers or outreach teams that are working with someone to find housing, um, right? It's not uncommon for them to work with a landlord who is flexible.
Mhm.
And usually it's your private landlords,
Mhm.
right? Who have built trust with that agency and don't require an ID or a background check for that person to move in and are willing to negotiate a lease. We all know typically with your corporate, organizations or your
Property
property management
management.
companies, you
Mhm.
can't really, it's difficult, but we get creative. And the same way with, as an example, working with undocumented folks, while our federal funding limits access to some degree, our state resources are there to fill that gap. Yeah.
Also too, because we know this is a barrier for this population, we utilize a system called our Homeless Management Information System. So we strongly encourage that our agencies or street outreach team, when they do receive the documents for these households, that they upload those documents in there. So in the future, if they lose it, we have a copy of it. So we try to mitigate that issue because we know that that is a barrier to the individuals on our streets.
Yeah, that's great. There's a bill going on being pushed at state level,
What's the bill?
2146, AB 2146, being led by Stephanie.
Okay.
And that is specific to this barrier, and then kind of just a solution about our hardworking folks here at regional level having to work extra hard and having to make those contacts and make getting those keys possible for our on-house folks. But we shouldn't just have to rely on being creative and
Right.
Yeah.
that we do
Yeah.
that. But there's a state level push to ensure that we can kind of streamline that process, or at least there's protections. So I'm glad to hear that.
You bring up a good point. I think where we often find the delay is for permanent supportive housing specifically, which is geared towards serving folks who have a disability. Getting the disability for a person that's been living in the riverbed for 15 years and has been disconnected from medical care is a challenge. So I think that's where that assembly bill will come into play. Some agencies have hired clinical staff that can go ahead and sign off on a person's disability. But again, those positions are expensive. These resources are limited. So, it's not always available to all. So thank you so much for educating us on that. We'll make sure to follow that.
It's AB 2146.
Any other questions? Thank you, Roshana.
No,
Thank you. Thank you, guys.
Thank you.
All right, one comment is on the funding, when you talk about that here, a lot of that was one-time funding. So, through like the American Rescue Plan Act and the CARES Act and some of the COVID solution grant dollars. So we were very, deliberate on how we allocated that money, so that we didn't create new programming that couldn't be sustainable.
Right.
But Tanya mentioned, and Roshana did too, about the capacity building so that we can sustain that for a little while. And then we continue to advocate at the state level too, for continued dollars.
And Greg used to be the chair of the Continuum of Care.
Yes.
Long time. Thanks again, Rashawn, appreciate it. You don't have any.
Well, I do.
Oh.
Emma says I do.
And once again, remove Emma's report to be next, so Emma, go ahead.
The reason why I wanted to move the report up was so that Roshana had an opportunity to be here, to answer any questions or to provide feedback. And I wanted the commission to have information about what the Office of Homeless Services does to contextualize, my update. Go ahead and go to the next slide. So at the November commission meeting, you may or may not remember, we had discussed utilizing the CSVG 2025 discretionary funding to cover our weatherization program deficit that was caused by the federal delays in receiving LIHEAP funding. Since then, we have received our LIHEAP funding, thankfully, and are no longer needing to use that discretionary funding for that purpose. So we met with the state and we discussed with them our needs, what our community needs assessment has called out as our top priorities for our community. And instead of using that funding for the initial weatherization deficit, we are redirecting these funds towards the growing countywide need for eviction prevention services, with a particular focus on supporting seniors. So you see here that there is a funding distribution on the left-hand side. We had a total of $551,000. And we're going to be making these dollars immediately available. We have already been receiving referrals from our coordinated entry system for eviction prevention services through our Office of Homeless Services, who partners with our behavioral health department. If you look at the flyer that I provided for you, this spring flyer, this is where we are funneling in constituents who are in need of eviction prevention. They're doing the eligibility, and Office of Homeless Services is partnering by paying, being the fiscal agent to pay the landlords. So they are getting $270,000 for anyone who's not a senior, essentially. Office of Aging and Adult Services will be working specifically with the senior population. It seems redundant, but it isn't. Adult Services has a specialized unit called the Crisis Response Team that responds with social workers directly into the field for seniors that are street homeless. So these are like emergent situations that need to be addressed immediately. They come through the Adult Services, Adult Protective Services hotline, and they're dispatched 24/7. Office on Aging handles calls for everyone else who, you know, is looking for services. They're referred by other agencies. They're referred by our family resource centers. So they're just a little bit different populations. So both agencies will be able to utilize the funding concurrently to help serve the senior population. One note is that while the state has allowed us to pivot and allocate this funding for this purpose, we have a very, very short timeline. We have to spend the funding by the end of June. So we're not going to have a problem spending it down. The need is there.
Yes.
What would you say the average need is for an individual who calls for eviction prevention services?
So by the time they call us, they're probably, or call Home Connect, they're probably about 2 months behind. And as Tanya mentioned, the average cost for 2-bedroom was about $2,500. So I would say in between 7 to 10,000, depending on the household size. So, I mean, it's not, eviction prevention is, if I was to say the fastest, it's the fastest program that we spend the most money in, the quickest. Yes.
Okay. So what about if there was someone that's on HUD or Section 8? Does this help them too?
Yes.
It can, yes, for their portion of it, yes.
That's what I mean.
Mhm.
Yeah.
Also too, I just wanted to know, and I didn't put it in the presentation, we have a homeless action plan. And we focus on 5 areas. One of our performance measures is reducing the number of individuals who become homeless for the first time. And homeless prevention is one of those activities that assist with that reduction for that number. So that's one of our action area goals for our homelessness action plan.
Um, so these efforts are utilizing CSBG's flexible funding. I wanted to highlight that they address the community identified priorities and reinforce the county's housing and homeless response system. And also they advance our mission as an organization of stability and self-sufficiency for low income individuals. So if you know someone who is in need of eviction prevention services, please share this and feel free to share it on your socials. This is not a secret meant to be kept. You know, we want to be able to share the information. Part of, you know, being a part of the commission is being an ambassador for the work that we're doing. And so, you know, please make sure it's also available on our website if you want like an electronic version, so you can get it. Perfect. And it's in Spanish too. So I will pause there in case anyone has any questions or comments.
I do have a question. Resources for low income, disabled, senior, anything at all? I was asked about, you know, if I knew of any help for that.
Yes, so Office on Aging has programs that are specifically tailored to help that population.
Okay.
Is there a just in general, or is there a specific case?
A specific case.
If you want to email me the details, then I can better assess where the.
I'll give them the info.
Okay.
Okay. Yes.
Feel free to connect them directly to me and we can help navigate them through those different services.
All right. Thank you so much.
You're welcome.
Lisa has a question.
Yeah, thank you. I did submit a public comment about this item on the agenda in relation to cross-referring those potential folks that are nearing eviction that are in their own home, if they're homeowners, that there be a cross-referral opportunity set up to refer them to the Grid Alternative Solar Program, because they could get the energy efficiency solar system put on their home. And then that would help them reduce their electric bill significantly. And then that would help them with home retention. So I did submit a public comment. It was kind of late. I think it was a couple days ago, but I hope it made it in and it can be maybe revisited. Because I think that cross-referring programs to one agency to another is so important, especially when we're talking about seniors and we're talking about having them stay in their home and having them utilizing these programs that are out there to help them. So thank you.
Thank you, Lisa.
I did have a question for Lisa with regards to that comment. Was that solar program, is that only going with Edison, or does that also tag on to like the local electricity
Like public
entities
utilities?
like Moreno Valley Utilities or something like that? Or is it just Edison or one of the majors?
Great question. It's a state program and it's only for the IOUs. So that would be Edison, Southern California Gas and Electric. I'm sorry, San Diego Gas and Electric, Pacific PG&E and SCE territories only. So it's not for the municipal utilities.
But I think Moreno Valley is Edison.
Part of
Moreno
Moreno Valley is, part of it is, and part of it is their own utility.
Should I go up there? I didn't even know.
Yeah, who knew?
Part
Who
of
knew?
it is.
There's a lot of little electric companies all over.
Yeah.
They have their own electric department too. I mean, electric.
Any other questions?
Not question, but Commissioner Heslon, you will be happy to learn that we have been sharing your information with our weatherization clients. Because we do have many who are seniors that are homeowners or on a fixed income and are increasingly being taxed with the costs, right? And the inflation and all of the things that are adding up, and our budgets are diminishing as these expenses are mounting. So we're definitely sharing that information actively with those individuals.
That's great. Thank you.
Thank you.
All right, I have another, yeah. So I'm going to be providing another update, and typically I would not be bringing 2 years of CSBG funding to the commission at the same time. However, as you all know, we had delays in receiving our higher allocation. Oh, I'm so sorry. That's okay. She says that this was her office that she guided me. Thank you. Oh, I'm so sorry. So we had delays, the government shut down. We weren't sure if we were gonna get the funding. There was a lot of uncertainty surrounding it. So here we are. Gave you the update on the 25. We're trying to spend that down, and we're also launching our 2026 CSBG program. So we are positioned to move forward with an initiative that directly supports and strengthens a program that was launched by Office of Homeless Services called Pathway to Home. And the Pathway to Home program or initiative is a county coordinated multi-phase response system designed to help move individuals from literal homelessness into permanent housing and to long-term stability. So you heard Roshana talk about how one of the gaps that we've seen in that system of care has been connections to workforce and helping folks get into some kind of education or technical program to really help them move on to the next step of becoming self-sufficient. So currently, there are 4 phases that were included in the Pathway to Home program, which she described: street outreach, emergency shelter, rapid rehousing, and permanent housing. The piece that has been missing has been employment, and largely because there really aren't funds available to help support specifically in this area. So what we are piloting is a program to add this component as a dedicated piece for the clients that are coming through this system. So we see this as a critical component for long-term stability because we know that without access to employment, job readiness support, or career pathways, our clients are really at high risk of returning to homelessness. So adding this phase is essential to helping these low-income residents build the income needed to remain housed and move out of poverty. So in addition to this, we are also setting aside funding for something that has recently been at the forefront of many of our discussions, which how many of you know about the work requirements under HR 1 for individuals who are receiving certain types of benefits?
I'm so, I'm a little.
So come July 1, anyone who is on a SNAP benefit is going to have a work requirement.
Yeah.
Come January 1 of next year, anyone who's on Medi-Cal is going to have a work requirement. Medi-Cal or Medicare is going to have a work requirement. In Riverside County, that represents 61,000 people in SNAP and 51,000 people on Medi-Cal. These are individuals that are going to be required and mandated to be enrolled in employment, volunteering, or having some kind of training, job seeking services. It is apparent to me, this is my personal opinion, that the intent of this work requirement really wasn't to connect people to work. It was really to kick people off benefits.
Yeah, that's what it is.
There was no funding allocated to help support this tsunami of people that are going to find themselves in a situation where they're going to have to figure out a way to maintain their benefits. And so we want to be able to respond and provide this support. So we're setting aside some of this funding to help with the response and hiring some temporary career coaches and being able to provide additional more enhanced career seeking opportunities. So we're planning on leasing cars so that our job coaches can actually go and like drive people to places where they need to get social security cards. I mean, all of the different barriers that this population has that really makes them disproportionately impacted by these requirements. So we are happy to be able to have the flexibility with the CSBG funding to fill this very critical gap. The folks that are on SNAP and Medi-Cal, they're our clients, right? These are mutual clients of ours. And so we want to be able to answer the charge and provide this support. So we are actively in developing MOUs and looking at putting together this infrastructure to help meet the call that is coming. And as this unfolds, we will be providing updates to the commission on our progress. I do want to share that this represents a 47% increase in funding that is being used to directly support programming from prior year. And my hope is, as budget permits, and this is a task that I've shared with Brandon, that we can increase that so that the majority of our funding is going out into the community and not staying, for admin or other services. Like, it's very important that we're actually in the community and that our dollars are at work serving the people directly that need it the most. So just to summarize some of the key enhancements, extending rental assistance and housing stability. So many of these folks that are currently in the Pathway to Home program have been on housing, so their 24-month clock is ticking. So for those that have not had the opportunity to be linked, we're going to extend their rental assistance period so that they have an opportunity to be linked to employment and give them a fair shot, right, at success.
Can I ask a question?
Yeah.
In Benton Hill. What about the seniors that are on housing, on Medicare and Medi-Cal? When I went to Sacramento.
Oh, seniors are exempt. Sorry, I
They're
should have said that.
Yeah.
Yeah, if they're
That's right.
over 65,
Okay.
they're exempt. So
I went to Sacramento, they said seniors.
well,
Okay.
between 60 and
Yeah.
65, they're
Right.
not. So,
Wait a minute, 60 and 65.
yeah, so it's 19 to 64, they have to meet this requirement.
Requirement,
Yeah.
right.
There's also exemptions though for like disability.
All right, anybody that's senior that they told me they will be exempt. It
Yeah.
won't hurt them.
But the figures that I shared are specifically the people that will be impacted.
Right, it's
So
like
we've
that.
looked at there are way more people than that on benefits.
Oh, yeah.
Yeah.
Oh, yeah.
So the second thing is workforce development integration. Again, we've already, I think, reiterated that. Seamless extension of the continuum to include this fifth phase. And I have one more just to illustrate. So this is the Pathway to Home program, and I don't know if Rashonda, you want to just go over it very quickly. I know you already talked about like the road.
Oh.
You can't see it. So, these are all of the street outreach, providers on the left. We have our emergency shelter providers in the middle and our rapid rehousing providers. They're all segregated by district. So just to show that, our impact is countywide. And the dollars are going to nonprofit providers because we don't provide direct services. So, these are all providers that have current contracts with the county, whose contracts will be augmented to include these additional dollars, and they'll be working directly with our workforce development and their partners to connect to the programming. And the beauty of this is that workforce development has other programs, other funding that they can also be co-connected to help really maximize their potential for success.
And just to add, all of our providers, we award them because they've been through a competitive bid process, because we want to make sure that we are awarding agencies that
Proven success.
with proven success. So I just wanted to add that as well.
And we use a formula based on our homeless point in time count that equitably distributes, not equally, but equitably distributes per district based on the representation or the need of that
Mhm.
particular district. So if a district has a higher need, then they're gonna get a higher dollar amount. and
Mhm.
vice
We have a
versa.
question down here.
Yes. Oh,
Quick question, do we have any commitments from business owners that would hire out of the program?
yes.
And we do have that.
Yeah, we do, and that's the reason why we have partnered with our workforce development department, because they have all of the commitments from the employers, yes. We actually partner with them a lot. We partner with them through their Employer Connect program, where we train or provide some type of training for the individuals that are placed in those employments. So yes, we do have employers or business owners that
We
are.
wanted to provide an incentive, but the state said it wasn't an eligible activity. So we were gonna provide like a
Yeah.
stipend to the employer as an incentive to hire the
Mhm,
clients, but
mhm,
they said no.
mhm.
So
Hmm.
take a talk with Supervisor Gutierrez.
Mhm.
We started a program in Moreno Valley called Hire Mobile,
Mhm.
right? And that program has continued since he's moved on, but it's a pretty strong program.
Yeah, it is.
To where when you hire someone from Moreno Valley to work in Moreno Valley, there's incentives that are not considered double dipping or anything of that nature. So I think it'll behoove us to kind of talk to him about that program and see how we can maybe push that countywide.
Great suggestion, thank
Mhm.
you.
Eric, question?
Yeah, I have a question regarding, so let's say, for example, a District 5 resident has a bad experience with Path of Life, and they complain to CAP, and there's an internal policy, but what happens, like, as far as the administrative shuffle? Meaning, are the partners that you mentioned, I think you said they contracted through the county. So so do they go through some type of consistent training to handle administrative burdens? So people don't get frustrated and then end up losing their homes. So I'm just wondering, what's the connection? I shouldn't say what's the connection, but and not even responsibility, but maybe just, I don't know, the goal, if that's even the correct word, as far as the partners to get these folks in and help them, as opposed to, them being fed up with the time reporting. So many people, residents have different issues and they just fall in the cracks. And so what about those residents? Have you guys considered that?
Yes, and as we were speaking earlier, our goal is to always improve our service delivery, our systems. We provide training. We actually just provided a case management training for all of our providers. We had about 200 individuals at that training. So we constantly are providing that technical assistance for them. We have a monthly technical assistance call with the goal of improvement and service delivery. And I had a second.
We also do the monitoring.
We do our monitoring, and also too, thank you, Greg. You just whenever we have a complaint, we have a grievance procedure that we follow, that we make sure that whatever that complaint is resolved. So part of that resolution may be, okay, we may have to see if there's another organization that may work better for that household. So we try to resolve that that household's issue as best as we can.
And we've had times where we've had to move clients
Multiple times, right. Mhm. But I have to be transparent. There are some that no matter what we've done, they're not. We have two right now. Well, one right now who's been through 9 different agencies, and we don't know what else to do with that individual. And that person is not permanently housed, but they're in temporary housing, and several units were offered to them and they're saying no to them. So, and they're still complaining and going up further to the Board of Supervisors saying no one is doing anything for them. So I have to be transparent about that as well, because we do experience that. That's not often. It's not, yeah, that's not often. We have, that's not the norm, but it is part of the equation.
But it
So,
illustrates the extent to which we really try to work with these individuals. I mean, you know, a lot of the clients are dealing with significant barriers, mental health,
Mental.
substance use disorder, trauma. So, you know, there's just a lot of variables that go into being able to provide adequate services to these individuals.
so all that to
Adequate
say,
to them.
yeah, all that to say, we try our best to mitigate those types of issues.
No, I'm sure you guys are doing great work and it's always a challenge. But, I've just been on that side of the coin before. And, sometimes depending on when you contact these agencies, depending on who's on the other line, what mood they're in, can certainly sway you or you can be like, I'm gonna give up and end up homeless. So I guess my concern is, and again, thank you for all the great work you guys are all doing, but the training for the professionals, whether it's training and with how to deal with LGBTQ folks or speech impairment, whatever. I'm sure you guys have thought about that. So that's kind of where my concern lies. Thank you.
Right.
And in addition to the training that we do from the county, is most of our providers do provide that type of training on a regular basis. So,
Right.
is that it? Any other questions for Emmy? I just want to reiterate, I think it's great that we're trying to get more money out into the community. And really, especially trying to deal with the people that would represent the most, those that are the lowest income, poverty. So great job and on the partnership, appreciate it. So, all right, moving to item number 4 is old business. We've gone over the bylaws, I think, in the last 2 meetings, so this is just the formal adoption, right?
Actually, so we were ready to adopt and then realized that we needed to correct our address because we moved.
But, yes.
And so because it is a correction, we needed to bring it back to the commission. The second thing is we also struck out, we had said that we were going to provide a stipend for mileage free, or no, I'm sorry. We had said that we were going to provide a gas card for mileage reimbursement. But because we have to use the IRS mileage rate, it ends up not working out because it's not a round number. And then we also have challenges with being able to purchase gift cards because our county purchasing changed the policy on being able to procure gift cards. So we changed gift cards to stipend. So that would just give us the flexibility to be able to utilize different methods of payment. Who knows what the method payment will be in 10 years. We'll probably be able to, I don't know, like telepathically. But in this case, it affords us the ability to be able to have that flexibility. So those are the only 2 changes. We sent them out to the commission for the 2-week mandatory or the 2-week required feedback period. We didn't get any feedback, so we're going to go ahead and just ask for approval from the commission, and then from here, we're ready to take them to the Board of Supervisors for formal adoption.
So I would entertain a motion to approve the changes.
I'll make that motion.
Okay, is there a second?
I'll second.
Okay, very good. Any further discussion or questions? We don't need a roll call though, do we? We can just. Do we?
No.
I don't think we do. I'm gonna make the chair's decision, say we don't. So all those in favor, please say aye.
Aye.
Any opposed? Any abstentions? All right, that passes. Thank you very much. We'll move on to item number 5, which is new business and introduction of proposed new commissioners.
Yeah. So it is my pleasure to introduce our 3 commissioners who will be going before the board on the 28th of April to be appointed to the CAB Commission. I know that Robin is on the call. I don't know if Amber is on, but we have Robin Gilliland, who is the District 2 private sector appointee. And then we have Amber Smalley, who will also be the District 2 Public Sector appointee. And we have the low income sector alternate seat, Miss Colleen Wallace for District 5. And I'm Banning resident and dedicated community advocate with decades of professional and volunteer experience in the PASS area. She has spent 30 years working in social services and has worked in medical records at Desert Hospital. Ms. Wallace has been actively involved in many community and regional organizations, including CAP, where she has served as past chair. She is currently our ex officio member on our executive committee. And through her leadership and service, she remains committed to advocating for local residents and supporting programs that strengthen and uplift low-income families. So please join me in welcoming. And our next appointee will be Robin Gilliland, and she is the owner of Robin Gilliland Consulting and also is a staff member for CityNet Homeless Services that specialize in development and community-based systems to address homelessness. She has over 15 years of experience. She works with many of the District 2 cities and also Riverside County partners to design and implement outreach programs, ensure compliance and oversight, and build collaborative frameworks that connect government agencies, nonprofits, faith-based organizations, and community stakeholders. And Robin is on the line. Would you like to say a few words?
Oh gosh, hi, welcome. Welcome to me, I guess. Hi, everybody. Very nice. Very nice to meet you all. I am really excited to turn my passion. We have complex challenges in the world today, and I like turning them into real solutions for communities. So I look forward to assisting all of you in any way I can, and just see what we can do and make a difference every day.
Thank you, Robin. Then our third individual is Miss Amber Smalley.
That's my girl.
I love Amber. So she is a senior legislative assistant and policy advisor for Supervisor Spiegel's office, and she oversees specifically the city of Jurupa Valley. Amber has extensive institutional knowledge, has worked in public sector for, well, I think over 12 years actually. And she has a passion for human services. She works with our department, Office on Aging, Education, and the Student of the Month program. She is very passionate about youth and students. She actually, I didn't know this about her, but she has a master's in professional school counseling. Did you guys know that?
Yeah.
And she holds a credential in pupil personnel services. So definitely is evident in the passion that she has for the children and the youth in our community. So we're very excited to have her join our board.
Yes.
Good three people, that's for sure. All right, moving to item number 6, is consent items, and that's just the approval of the January 15th meeting minutes. Is there any questions or corrections on those? Not, I'll entertain a motion to adopt those.
I'll make that motion.
Thank you. Is there a second?
I'll second.
Okay, thank you. Any further discussion? If not, all in favor, please say aye.
Aye.
Any opposed? Any abstentions? All right, thank you very much. And we will skip to item number 7.2, which is the grant financial performance report. Brandon.
Hello, everyone. My name is Brandon Traha, Fiscal Manager for Community Action Partnership. Many of you may already know me, and welcome to our 3 new commissioners as well. So I do have some good news. We've been making a lot of great progress on spending our grants. So the first one that I would like to Also, I've been able to get the latest and greatest information up to March 31st. So you have up to the minute information. So we begin with our CSBG 2025 allocation. There's a lot of green, which means that we have spent the vast majority of this grant. The only item that's left is going to be that funding that Emma and Rashana talked about earlier that will be awarded to the Office of Homeless Services. We have an extended end date of June 30th for this grant from the state. So definitely we're going to be hitting the ground running with those programs and finishing out this grant.
Quick question. With the funds that need to be spent by June 30th, is there anything from the state that's going to re-up with that? Do we have to spend it in order to dip back in, or is it just we spend it, we're closed, it's a one-off?
So it's a one-off grant. So if we essentially, if we don't spend money by June 30th, we just lose whatever money that would be left unspent, but we would still get our 2026 allocation and so on. So it's not any.
Each annual allocation has to be spent within the fiscal year, basically.
Gotcha, okay.
Yeah.
Gotcha.
And the June 30th in particular is for when the services need to be provided. So we have a little time after that for all the fun paperwork, but but yes, I know that definitely the next 2.5 months, Tanya and her team at Office of Homeless Services will be hitting the ground running and making sure that we make this whole page green. And now we are heading into the future with our 2026 allocation. This started on January 1st, and we've already got a good 13% spent so far. This does include the money for the Pathways to Home program for Office of Homeless Services, and Workforce Development that's a very significant part of this grant, and we're very excited about it. All right, and then we have our energy grants. Our LIHEAP 2025, I can definitely bring some energy to the room by letting you know that this grant is, we have met our 99% spending goal. We are 99.99% spent. So very good there. We've helped a lot of people with utility assistance and with weatherization. And that's, thankfully, we have our LIHEAP 2026 to continue that trend. About 10 million has been awarded to us so far, and we've already spent out about 1.6 of that. So making good progress, including helping our utility assistance and weatherization clients. And then one of the big items here, the Department of Energy, our DOE IJA for our Infrastructure Investment and Jobs Act. Sorry?
Kindly extend a little bit more that. Yeah, I forgot my glasses, sorry. Thank you. That's perfect, thanks.
Perfect. And so right now we are in that phase where we are spending the first 50% of our grant. Right now that is 2.8 million. And we are about 10% spent so far. We're preparing to begin really working on our units. And so in the near future, probably by next meeting, you'll be able to see that we'll have a lot more spending because we're going to be getting our weatherization units worked on and sending those subcontractors out to do the work. And then just at the bottom there, we also have another Department of Energy grant. That's always a challenge. We've got grants that come together at the same time, but we are confident that we'll be able to meet our goal spending this one as well. It's a pretty small one. And finally, we have our other grants, our dispute resolution program. So we are right on track with this at about 65% spent, compared to about 75% of the fiscal year that has passed. So we're looking forward to making the most out of that. And we know that there's so much benefit that comes out of that program. We have a new one on here for everyone, Golden State Opportunity. This is a program where we will be, I want to say promoting and letting people know outreach about the earned income tax credit to make sure that people within California can take advantage of that. If they're entitled to it, we want to make sure that they're able to get that money. So we have 40,000, which is going to go toward various costs associated with that. And finally, our Cool and Warm Centers. We've completely spent our grant for Southern California Edison, and we just have a little bit more left to go for our grant from the Regional Access Project Foundation. So we're very grateful to both of those entities for continuing to fund us every year.
Randy, quick question on the Golden State Opportunity. Are those like workshops, training programs that are being put together for the community? Because the earned income credit, they've cut that, brought it back, cut it, brought it back, cut it, brought it back. So that's particularly the training, not the issuing of, correct?
Right, that's going to be more to training and letting outreach of letting people know about it. And Monica, do you want to give a little more detail on that?
It will be to promote and make sure people have access to get free tax assistance so that they can receive the earned income tax credit, but also the foster youth benefit credit for California residents, and making sure that people know where to go, and even during off tax season. So as we know, yesterday was tax day, but we want to partner, we're going to use some of this funding to partner with some of the sites to be able to offer multiple years worth of tax filing for those that have missed the deadline. And one of the agencies that we partner with, for example, is Starting Over, and they specifically help the re-entry population to make sure that they get access to their transcripts because they haven't filed in multiple years, to be able to catch up. And so that's where some of that funding will be going. And you'll see some of the numbers up next. Okay.
And I'm sorry, his question when he said, maybe you answered and I didn't pay attention closely. He said, are they gonna be trained, or are we gonna help them how to do it, or we reach to inform them if there is a GSO? Which is it?
So we are not, the funding isn't gonna go to training. It's gonna be, some of it is gonna go to help support the sites where the public will have access to file their taxes. And then additionally, we'll be doing a lot of promotion and help, like social media posts, to make sure that the word gets out to the community that they have access to these tax credits, but then also where to go to file.
It's a lot of marketing.
Okay, like including senior centers, and Vita used to do that. No, it doesn't do it.
They'll be supporting the Vita site.
Got it.
Yeah.
Thanks.
Any other questions for Brendan?
Yeah,
Thank you,
Brendan, I have a question.
Sure, go ahead.
Yeah, was it 8.6 million keeps standing out to me. So I'm thinking about the 1% of the weatherization spent. And I know we talk about budget challenges and different things, but what are we doing to get those dollars into the hands of these residents?
So I believe I'm sorry, go ahead.
No, go ahead.
It sounds like you're referring to the 8.6 available for LIHEAP 2026.
Yeah.
Okay. Yeah, the 1% at the bottom is more for that small Department of Energy grant. But the 8.6 for the LIHEAP 26, we just completed our LIHEAP 25. So we always have that interesting case of 2 years of a grant overlapping. And so normally we will finish the 25 and then start on the 26th. So that's why you're seeing only a certain amount spent so far. But we do have all the way through June 30th. And in particular, Emma, if you want to add anything about particularly our approach to weatherization.
Yeah, so for our DOE IJA program, we have been aggressively working with our Riverside County, RCHC, what does the HC stand for? Housing Corporation, I think.
Yes.
Anyway, it's through our housing authority. It's a separate entity, but working through our housing authority, our affordable housing projects and projects where the county owns the property, but we have Section 8 clients that are living at the properties. And so we've been partnering with our community development program and our housing authority to target those properties for weatherization services. We've also been working with our utility assistance program to get applications from individuals who are coming in for utility assistance to help reduce their energy burden. And those are some of the clients that I referenced earlier for Commissioner Castellone, that we are referring them over to Grid Alternatives as well if they're homeowners. We're also working with some of our shared housing providers to identify properties where you have individuals who are in transitional housing or foster youth that are in shared housing to help provide that support. We actually have the weatherization program manager over here, Javier, who's overseeing our weatherization team. So we have right now are focusing on a property out in Ripley, which is towards Blythe, where we have 70 units or so. Yeah, duplexes and single family homes and triplexes that we are targeting for weatherization. So that funding will begin to dwindle down. We have a target of 140 some homes to do by June, and we're hoping that in the next couple of months, we'll be able to make a significant impact in completing those projects. So there's been a lot of moving pieces to it, but we are confident that we will be able to meet our goal, and actually, I mean, we'll probably exceed in terms of the number of units that we identify and the funding that we have. So, you know, we will definitely be providing an update as our progress continues. And we're really excited about the work that we're able to do. We're actually going to put together some testimonial videos for you guys. So hopefully I can have those by the next commission meeting because stats tell us, you know, tell you our impact, but to be able to hear the stories of the true impact that it has on individual lives is just right. It's just so so meaningful. So I will make sure that you guys have that and that you're able to feel connected to the work that we're doing as an organization.
Thank you. I have a follow-up question regarding the HR 1 and funding, and someone mentioned earlier about using funds and hiring or renting cars or something, which I think is you know, possibly great. But what about, are you guys hiring folk and training them, or at least hiring folks to help people with, you know, navigate the their benefits, those forms and filling that out? Mm-hmm.
Yes, so they'll be, well, we're gonna hire 2 career
And you were
coaches.
cutting me off.
Oh, oh, sorry. Ooh, what happened?
No, you go ahead, but I'm saying you keep cutting me off, but go ahead.
I'm sorry, I thought you were done. No, go ahead and finish.
No, you were no one, I'm done, but yeah, I would appreciate that when I'm talking or anyone's talking, not to, because it's kind of dismissive, and I'm just inquiring about District 5. Thank you.
Yeah, apologies for that. That wasn't my intent at all. I guess I'm just excited to provide the information to you. So yes, we are going to be hiring 2 career coaches that will be providing intensive case management and supportive services. We call them career coaches, but specifically what they do is They do job readiness, they do resume writing classes. They really help the individual holistically. So if they need, for example, interview clothes, they will provide that to them. If they need skills with the actual interviewing process, they'll work with them to develop those skills. If they need, an ID or a social security card, because oftentimes you'll be required to provide that when you're applying for a job, then they'll connect them to be able to get those. That's part of why I reference, leasing cars with the funding, is because the career coach will have to drive the person possibly to the DMV or to the social security office. It's really beyond what they currently do for individuals, because we know that this particular population has these additional barriers and is going to need that additional support. So I hope that answered your question.
Eric, I would just add to, as far as like the Medi-Cal redetermination and work requirements, there's other departments within the county that will be helping those individuals. So like Department of Public Social Services, our workforce division within our department. So there's a lot of different organizations that will be addressing some of those issues around HR1 as well.
Yeah, thank you. I was just, and I guess we'll get to it, because the email that we received, or, as commissioners, like to sort of put this out on social media. So I'm just, and that's great. I love doing it. But I'm wondering if the outreach is there, because it seems like we have the money, but are we actually, and no disrespect at all, and these are really questions, but are we getting, just, are the people aware of what's available? And I know the county does their thing and everybody, but just as these community funds are available, it's just that outreach of I don't know if it's just knocking down more doors, or just, getting this reaching the people. And then last thing I'll say, I think it was maybe last year we talked about the GRID program, which I think is wonderful for people. However, and I'm wondering also, because you guys keep pushing that program, are we thinking about our low income owners? Because a lot of times those HOAs, they belong to HOA communities, and when they go with the solar program, this potentially they will be kicked off of the, I shouldn't say kicked off the HOA, but then HOA becomes no longer responsible for their roofs. And maybe, yeah, this is saving them some monies as far as maybe utilities, but then what if there's damaged roofs? So there's concerns there. So when you guys are spreading the word, are you also sort of taking into consideration that component?
Yeah, it's not our program. Commissioner Castellone is, she works for Grid Alternatives, so we're just sharing the information as a community resource. But I think she can, speak to maybe advocacy work that's being done related to that. I don't have the knowledge to be able to comment.
Can I give 2 cents on that? I have both. I have solar panel and I have HOA, and they do charge me my fees, and they have nothing to do with no participation whatsoever with my panels. And there's a program now that if I want, including from the previous owner, I had a leak that we didn't caught it when we bought the house. And when the roof was leaking in the master bedroom, I brought Tesla, and they said that they found buckets, 10-gallon buckets from Home Depot. So that people that sold to us, they were deceiving. And the house was sold as is. So HOA had nothing to do with it. It was just our doing. Our checkup didn't do the truly job that was supposed to. And until today, I haven't fixed the roof. I just haven't fixed the buckets. So, but
Yeah,
HOA has nothing to do with it. Yeah, just by 2 cents.
Sorry. I appreciate that. No, I was saying, I know HOA would not have anything to do with damages. What I'm saying, though, you lose that protection as a homeowner. If you go and then have a grid installed, then if you have future roof problems that currently your HOA would cover. Once you add something to your roof, for example, going with the grid program, then HOA becomes no longer responsible for any damage, future damage to your roof. So that's a gamble, and could be a costly gamble. That's all.
Thanks, Eric. Appreciate that.
Mm,
All right, if there's no other questions, we'll move on to item 7.3, which is the program's Q3 update.
Lisa.
Oh,
Thank you.
I'm
I
sorry,
have
Lisa.
one quick question, and it's not about Commissioner Eric's question about the grid and warranty. We could talk offline if you would like to call me. I'd be happy to go over our program and the rules and HOAs, but my question is more towards CAP and future grant opportunities. I'm just curious. I know a lot of these are very large grants, the DOE, very big buckets of money, and I'm wondering, I know at our organization, the Grid, when we have multiple offices and we collaborate and determine which office is going to be applying for grants. So we're not, because we don't want to compete, you know, with ourselves across different opportunities. So I'm wondering, how does CAP determine which grants you apply for? Is it done on a state level? Is it more of a national approach? I'm just curious.
So the grants that we receive are allocations, they're not a competitive grant. But there are other grants out there that, should we qualify for them, we would apply for them based on the guidance found in our community needs assessment, or I should say, based on the priorities that have been established by our community needs assessment. So, if there's a grant that, as an example, provides assistance for dental care, and we qualify as an organization, then we could apply for it potentially and compete for those types of grants. We receive a subscription on a weekly basis, a list of available funding. And so we routinely, myself, go over that listing to see if there are any grants that we qualify for that would help support, augment our existing programming. There hasn't really been much out there. It's just it's been a difficult financial landscape across the board. So, but definitely something that we're actively pursuing as an agency.
Thank you.
You're welcome.
All right,
I'm gonna go over some of the numbers from Q3. So hopefully everybody can see the screen online and mid. First, I want to go over the cool and warm center numbers. So we did have an exceptionally warm March. And we typically have our warm center season to cover the cold temperatures up until March 31st, but we extended it to April. So the final numbers are not posted for the season yet, because many of our centers are still open and assisting a lot of customers, because we have had high peaks of warm weather throughout the region. And even though there's been a few days of rain here and there, more often see unseasonably high temperatures. So luckily, a lot of our centers are, flexible in serving the needs and adjusting to the climate, and have kept their doors open for an extended period of time. So we're thankful for that. And then just a heads up, our cool center season officially kicks off June 1st. And we will be having a kickoff meeting with all of our partners in May. I believe that the date is May 12th, just to kick off the season, make sure everybody's ready and prepared, because we do expect there to be a lot of really high temperatures throughout the summer. And these are the numbers of the visitors that we've had so far, just from January to March. So all throughout the district, there's been over 4,000 visitors through our centers. And this is usually our lower season, because obviously during summer months is when we see the peak of visitors. But there's the centers have still been pretty busy. Next. Yes, you can do it. Now, thank you. We did, when we had the heat wave, we were approached by multiple news outlets for interviews, and luckily, The commission chair, Greg, was available to do an interview, especially for the desert community. They were very interested in publicizing the cool Wars.
Resources and shelters get Apollo went out into the community, has been speaking directly with county officials. It's the story.
They say in the desert, you can't beat the heat, you learn to live with it. But this week, the heat is hitting so early, even people here are doing a double take. Triple digit temperatures are showing up in March, not July. Riverside County officials say it matters. When extreme heat hits before people have time to adjust, it can be especially dangerous for seniors.
Lived there 22 years, almost 23 full years. I think it's never been this. Library location.
It's not so much a big place, but it's still
Differently, many may wait they're outside anyway, or not even realize how fast the infection is setting in.
Like the Western Friday. It did, you can.
Maybe the biggest takeaway in all of this, you have to be able to stop the heat. Someone, but it-
And especially during the summer months or any other time that there's a heat wave, we usually get a lot of requests. So we'll make sure to make all those links available to you all when, once we get them. And we get interview requests in both English and Spanish media.
Oh.
The next numbers reflect our dispute resolution program. And just as a reminder, we do have volunteers stationed at 5 different courthouses throughout the county. And we have both listed here the number of volunteers and the number of participants that have participated in the program from January to March. So across all districts, we've had 38 volunteers and 259 participants were served. And this is represents a relief for the court system because a lot of the cases are mitigated and reach a decision. So it helps alleviate the court scheduling and the calendar. For the VITA program, even though this season we didn't have as many sites as we typically did, I believe last year we would have upwards of 17 to 20 sites. This year we had 5 sites, but then here we have reflected 4 of the sites, their data, because the big site is still on spring break and they haven't submitted their data. So even though we had a smaller amount of sites, they were still small but mighty, and they were able to serve a lot of customers in a short period of time. So from January to March, they're over 1,300 federal taxes were filed. And again, taxes went up to yesterday. They were really busy. So this doesn't reflect the total number of clients served. And we do have 2 sites that will be doing taxes all the way up into the October 15th deadline. And one of our partners is also starting over, who's helping with the homeless. They confirmed with me today that they already have appointments booked all through the end of June to assist multiple year filers that missed their April 15th deadline. And same with our Coachella Valley site at CET, Center for Employment Training. They already have a long list of customers that are waiting to book an appointment. And they said they were extremely busy yesterday serving all the last minute filers. So And those numbers, the dollar amounts is the number of refund amounts that's coming back to the county and into the customer's pockets. Yep. And LIHEAP, so our LIHEAP team is smaller and we have, we do have a lot of customers that are going to our old building still, but we are try to do everything we can to make sure that they know where our new locations are and how to reach us. And we are taking our show on the road and trying to do a lot of utility assistance clinics and meeting the customers where they're at. Primarily, our focus right now is working a lot with the senior apartments and going to the seniors because they're having a hard time getting through our call centers or reaching us. And we are working with the care coordinators there on site to get the applications and helping in every single district. Additionally, some of our cities like Banning, that's why Miss Colleen is excited. The city of Banning Utility has had a couple issues with their billing. So they're a few months behind and customers are getting surprise bills in the thousands. So we have been out there every single month doing a clinic. Our next one is next week, and at every clinic thus far, we've had over 60 participants lined up to participate. And we have assistance from a community partner, Faith in Action, who's on site to help the customers use copies of all their documents, download them. And then we also have the city of Banning. They're on site as well to inform them about utility assistance programs that the city might offer and to offer copies of their utility bills.
I just gotta tell y'all, when I first got on city council, community action, I fight for homeless kids, all that. Nobody knew about community action. I used to live up here for 40 years in Riverside. Well, after I left Banning and go to college, and nobody knew. I was the first one when I first got on city council to bring them to Banning because they didn't know about it. We were a disadvantaged community. You know what I'm saying? It's like, man, how you don't know about these people? I use them every year.
And you can see that we are just from the last 3 months, close to 1,000 community residents have been assisted with utility assistance.
Yeah.
For the clinics that you mentioned, you'll be taking on the road, how does one find out about those? Like, how is there a dissemination process?
So it depends on the clinic. It's just gonna be, for example, if it's a senior housing, it's just for the residents. And if it's a situation where it's open to the public, we will post it on our social media or we'll post it in conjunction with the partner that we're gonna be working with.
Yes.
And also we are working with the Board of Supervisor districts, but we also welcome other partners. If you know of other agencies or pockets of communities that where we can take the show, please let us know and we're happy to partner. We do have a new partnership that will be starting at the end of the month with Riverside Public Utilities as well, because we do have a lot of customers that receive RPU bills and we assist with the share applications. Where we'll be on site at the RPU Customer Service Center every Tuesday to be able to assist.
Every Tuesday.
Is that Instagram, is that Facebook, what is? Okay. Just so we know where we can kind of do outreach and just kind of refer to, so they could do their own footwork to it, kind of just be updated and.
And then we also try to make sure that our website is always updated on the news and events on locations.
Awesome. Thank you so much.
But we are trying to, again, target the communities that may be harder to get a hold of us. And then just as a reminder, we partner with all 5 family resource centers across the county to intake for us and then send the applications directly to us. So there's a family resource center in Harupa. We have one in Mead Valley, Temecula, Desert Hot Springs, Mecca. And then we also have a Hemet office that works in conjunction with the EDD and workforce development. And then we have a staff member out in Blythe to be able to help do intake as well. And at the family resource centers, if the customer needs help downloading their bills from online or making copies, the staff there will help them with all of that. And pretty much every family resource center has bilingual staff available as well. So we try to make sure that our access to our programs is accessible to all regions of the county, but if there's pockets that we're missing, we ask for the commission to please let us know. If there's partners, there's communities where we can make sure that we make a very concerted effort to reach them.
And like Monica shared, we're working closely with the Board of Supervisors so that they can help us identify pockets of their community. You know, they host town hall meetings and they're hearing from the residents. And so we want to make sure, and it's important to them that we make these services accessible. So, you know, actively working with them, and they'll also be sharing the information on their social media accounts since it's a partnership.
And then we're also, while we're on the topic of LIHEAP, probably by the time we come again to the next commission meeting, you'll see some updates with technology. We're trying to use technology as much as we can to allow customers to make appointments virtually online, and to also be able to open an online portal. But one of the things where we don't want to make it a complete open to everybody is because we do have priority points. Since the funding is limited, we do have to focus on the most vulnerable population. So we're going to create a system on our website that will do a virtual pre-screening to let them know whether or not they would be eligible, to kind of eliminate them having to go through the entire application process and then having staff to go through it if they would not be eligible.
And eligibility would be dependent on like income, I'm assuming.
Income, household size, energy burden.
Non-migration status is also considered.
Is it?
Yeah, okay.
LIHEAP services, the applicant has to be, have proof of citizenship.
And you have to be 18, correct?
18 or older. Mixed status households can apply, but the applicant themselves has to be, have proof of citizenship.
So it's a struggle when you have a single parent who is the mixed status and the children are under 18. Yeah.
Next. Weatherization, this coincides with the big push to get DOE housing off the ground. It's a lot of groundwork is being laid, so the next couple months, you will see a huge increase in these numbers. As of now, there's 26 homes that have been serviced all across the district, but this is, again, just as a reminder, this is a lot different from utility assistance where we're processing the application. This is home work in the home that involves a lot of subcontractors going out to home visits and making sure that there's tag team with the customer to be able to access their home, which sometimes can delay the process. No. This is just so that you know, I think it was also sent out, and a lot of the flyers are also available on our website. If you ever needed access to any of our program flyers to share with your constituents or to share on your social media pages, everything should be available on our website. Any questions on the program number?
Thank you, Monica. Appreciate that. All right, item number 8 is just informational items. Item number 9, the announcements.
I actually have some announcements. So the Riverside County Office of Education has just launched a new app called Foster Ferret. And it is for foster youth, for them to keep all of their information in one spot. They also have ways for them to earn funding for their needs. The app was created by foster students for foster students. They had consultants sit with a lot of the kids within the program, and they had their ideas, and the kids were like, no, that's not helpful. That makes no sense. We're not going to use this. So our superintendent and staff said, ask them what they want to see on this app. And it is absolutely brilliant. One of the things that was very imperative for them was to upload all of their information, birth certificate, medical records, social security, transcripts, just any and everything, because they're always lost in translation. It is free for them. a way that they can earn money to purchase snacks or anything, because that's something else that they said. A lot of the homes ration their food and do not allow them to have, you know, the things that we take for granted, cookies, candy, chips, and things like that. So one of the ways that they are encouraging them is to do, I think it's weekly wellness checks. And with every wellness check-in that you do, I believe it's $5 goes into their account to, you know, get something like that. There is also a 24-hour staff member who is a licensed psychiatrist as well as psychologist that will talk to them if they, you know, are in need of anything. It also helps them keep track of where their siblings are. So it is wonderful. It is such a wonderful program. It just launched this week. So I implore all of you, please go to Riverside County Office of Education website and look up Foster Ferret. And there's so much more that I did not include because it is just so encompassing. And it was amazing that they listened to student voices and heard what it was that they needed, because they were looking at things from, you know, a different lens. And the kids said, no, that we don't want that. We're not going to utilize that. This is what we need. We need to know where our siblings are. We need to know where our transcripts are. We want to do all these things. Something that they are going to implement probably within the next month is something that we approved, is a way for them to engage in extracurricular activities such as sports, dance, just anything like that. Resources for jobs, career tech. It's literally just all encompassing, and it is a portal. They have turned it into an app. We approved an app designer to come in and sit with them. They even design how it looks. And so I'm super excited about it. And I just want to spread the information as much as I possibly can.
That's only for our COE.
No, it's for Riverside County Foster Youth. And
You said it's fair?
it's called Foster Ferret.
Ferret.
Yeah.
FARET.
Mm-hmm. It's beautiful, and they're trying to get it to go statewide, and I know that they have been traveling up and down the coast and have given a lot of presentations on it. I know that I think it was CSEA's conference that was in San Jose or something last month. They were very interested in it, and it looks like they're going to be adopting it as well. And so word is starting to spread, and a lot of different states have even reached out to ask, you know, what is this about? What's going on here? What's happening? That is such a good question. Off the top of my head, I do not know, so don't quote me, but I believe it is from the age of 10 up through 21.
Okay, that was my question.
Yeah, that was my question.
Sure, like I said, don't quote me. It could be 9, but I'm pretty positive that they went with the double digits.
Because we work with transitional age youth, and so that goes up to the age of 24, and so like non-minor dependents can go up to 24.
And one of the things that I was really excited about to read about as well, the foster youth were presenting to us what they came up with. And they said one thing that we want to see is, aside from wellness checks, as well as personal grooming. And they said you would be surprised how many people just do not know the basic concept of deodorant, brushing your teeth, you know, combing your hair daily. And they were saying, you know, it affects us because I have to share a room with this person. So that's also encompassing with the daily wellness checks as well. And it's kind of like a journal and a diary that, you know, I'm not feeling too good today, or I feel like I need to speak to someone, or I'm lonely, whatever the case may be. And, you know, they can ask for someone to contact them or anything like that. So it's wonderful.
Always.
I do have a question.
If you haven't already, I'm sorry,
No.
I'm sorry. If you have not already, I would say reach out to Chief Wright with
Chief Wright?
JJCC
Okay.
and the Juvenile Justice. And also reach out to Ramon Ramos with the CBO Alliance.
Wait, you're telling me a lot of info.
Chief Wright,
Yes, 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 yes.
Mr. Wright.
Chief Wright.
And the other one was Ramos, I think.
Okay. And Ramos.
But I don't know what Ramos is, a COE or what. And it's Ramos?
He's with the CBO Alliance. He's the head of the CBO Alliance. If you need the contact information, I can get it to you, but that particular app and that program, because the Credible Messenger cohort would be a good avenue for either counseling or mentoring or things of that nature as well, to add to that component for that particular center.
Okay.
Because they really go under serviced for real.
Yeah.
And I
they
know
do.
Chief Wright is heavy on the foster youth,
Mhm.
as well as, I mean, JJCC right now, the changes that they're making, heavy foster youth, and the CBO Alliance is really picking up.
When I get home tonight, that's the first thing I'm gonna do. I'm gonna email and let them know,
Yes,
you
yes,
know,
yes.
yeah, for sure.
He's
That's
Mr.
for-
Wright.
Yeah, he's Mr. Right.
We have 7 minutes left. Anybody, do you have a comment or question?
I have a question, or actually a comment, and thank you so much. That was so important. I'm also a court-appointed advocate, a CASA. And right, and you are absolutely correct. And I just had a CFTM a couple days ago, and one of my case child, the one thing that he was wanting was to be able to stay in contact with his sibling. So I'm so glad that I'm here tonight to hear this. But now you said this is exclusive to, is it just Riverside County students, or it's an app county, say what? Okay.
It is exclusive to Riverside County students. So it's not just our COE county students. It's basically for our county, our students who are in foster care within Riverside County. So, yeah, like I said, if everyone please go to the website, Riverside County Office of Education, and you'll find it on there. It is called Foster Ferret. And it's starting to really take off. Like the amount of traction that it has gotten just over the last month has been amazing. I'm super excited to
What
see
we
this.
can do as
Yeah.
well is just I see Brandon already found the information. We can, it's okay, Brandon, we can send it, we can send it out. We can send it out to all the commissioners after the meeting.
Yes, 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 yes.
I tell people, our kids are the future.
Yeah.
And you should ask your kids in school, when I go talk in schools, I always ask them, what do you want?
Right.
Don't worry about what I'm telling you I want to see. You are future, so I'm definitely.
We have one more announcement and we have 5 minutes left. So, is it okay if we?
Yeah.
Okay. Just really quickly, we are partnering with Child Support Services Department for a couple of events, and they've specifically asked for volunteer participation. So I wanted to make sure that you were all aware that we will be sending out some volunteer opportunities. So if you are interested in representing CAP at these events, one of the events is a large backpack distribution, which CAP will be supporting financially. And it'll be in Riverside, right?
Yes.
Yeah, so we don't have the dates or the specifics yet, but as soon as we get them, we will be sending it out. And we would like for you to also, if you have networks of people that may be interested in volunteering, that you feel free to share it with them as well.
Okay. Sounds good. Thank you so much.
Can I do my announcement? Yeah, please. All right, so I had an announcement, and we'll send this out. Brandon will look up our website. It's www.iesaves.org. And for District 1, we received a proclamation from Jose Medina. We have a big, huge one in our office in a frame. I just wanted to make a picture of it for you that you can have. And this month is Financial Capabilities Month, Financial Literacy, Financial Empowerment Month. And last week was what they call America Saves Week, Inland Empire Saves Week. So that is what
the commissioner and the board of supervisors were recognizing. Brandon's got it there on the screen. Each day of the week, last week, our very youthful Gen Z millennial staff recorded a video for each day of the week that you can watch to this day. When you're talking about the foster youth, things like that, it meets people where they're at. It's non-judgmental. And just the delivery in the videos, there's a little pledge to become a saver. And it's nothing where we spam you or send you junk mail. It's little motivational things where you make a pledge to yourself. I made a pledge over 20 years ago to get out of debt. Debt is a form of savings. I had significant credit card debt. I went and listened to somebody like me speaking, and I did the little sign up. I made a little pledge like this. And because I did it, you're 50 to 70 times more likely to do it if you make a pledge to yourself. And I thank that person who led that meeting because I got out of debt that way. So thank you.
Hey, it's Alicia, District 1. How do I get a copy of that?
Yes, we can, the email. Yeah. Mhm. Yes.
Okay, thank you.
It's not an announcement, but just a pledge or, if maybe with the foster fair can connect with credit.org, because when we've done the foster youth tax events, one of the biggest issues that we've come across is a lot of the students have experienced identity theft. And I know Melinda's agency does a lot of education around identity theft and how to protect yourself from that. But so maybe that could be something that could be.
The person who is the brainchild behind this and in charge of Foster Ferret and the creator, her name is Amanda Corridon. And her information is on the website as well. And she's amazing. If you don't remember that or whatever, just reach out to me and I can send her contact information. She's very responsive, especially for Foster Ferret. Thank you.
And that information is going to be HIPAA
All right.
anyway, so.
No other announcements will adjourn at 7:29. So thank you, everybody.
Thank